Hi everyone, my name's Ashley. I'm a nurse with the Caring for the Caregiver Skills Workshop team, and I wanted to do a video for you today about quick tips for medication management. First of all, I hope you're all doing okay, that you're safe and healthy, and I hope that these tips can help you at least a little bit with everything going on during these times. So the first tip I have for you is to have an up-to-date medication list. So this list would have the names of your medications, the dosage of your medications, the route, so that would be how you're taking it, so that could be oral or that could be an injection, however you're ordered to take that medication. The frequency, so how often in a day are you taking it? Is it once a day or twice a day? Or maybe it's something where you can take it up to 3 or 4 times a day as needed, however they ordered you for the time frame to take that. And then another thing that's really important to have on there is the reason you're taking that medication. So there's a lot of medications that have multiple reasons why you could be taking it. So it's important to a provider to know why you specifically are taking that medication. And we have different forms available for you on the website. Any of these forms are good. They all work. Just whichever one you find you like the best is fine. Just as long as you have that information on it. That's kind of the most important things you need on that kind of list. And then my second tip is to have an up-to-date medical history. So this would include different diagnoses you've had, whatever kind of past surgeries you've had, what allergies you have, and not just what allergy, but what kind of reaction did you have. So if you have an allergy to latex, for example, you could say that maybe you have itchiness, or it could be something more severe like you broke out into hives, or you had an anaphylactic reaction and maybe you had trouble breathing. Those are very different scenarios and different types of reactions, so it's good to differentiate and distinguish that when you're telling your provider about what allergies you have. Something else you'd want to have on there is the doctors, your providers, and you'd want to have their phone numbers, their names, their addresses on there. Those are good information just to help you keep track of things too. And then also the pharmacy and the phone number and address of the pharmacy that you go to. And this brings me to my third tip, which is to keep your important documents in an easy to access place. So I recently learned that if you have an emergency and EMS comes to your home, they will look either on the refrigerator or they'll look on the front door to see if they can find those documents. So it's important to keep really important documents like this in an easy to find place like that. And this would even include advanced directives or an out-of-hospital DNR. These would be good places to keep those forms and documents. And actually even a glove compartment or a purse would be a good place, just so someone can find those really quickly in an emergency. And then my last tip for you is to plan ahead for when to get refills. So especially now with everything going on, it's a good idea to probably keep at least 2 to 3 weeks supply of your medications. So just try and look and plan ahead for making sure your medications are not going to expire. Look to see how many refills you have left, so you know if you need to schedule an appointment with your provider to set up to get that refill redone. And then also, even with a lot of the pain medications and some anxiety medications, those are usually a little bit more controlled. And so most of the time you can only get a 30-day supply of those anyway. So it's just something to keep in mind and plan ahead for when you need to go see that provider again to get that refill up to date. And that's all I have for you today. So I hope you stay safe and healthy. And thank you so much for watching this. Have a good rest of your day.